Hello, my name is Steve from CDMCases.com. Today we are going to go through a clinical decision-making case that you will be seeing about 2 sections of the day on your COMLEX Level 3 exam. In the morning, you'll have 3.5 hours of 13 cases each, separated by a break. So that'll be a total of 26 cases. And that'll count for about 25% of your total grade. So it's important not to neglect this. And so we have a product by demand. People have contacted us and asked us to produce this. And so here we go. And I'm going to demonstrate it here today. So we're going to do one of our free cases that anyone can try out for yourself. It's available on our website at CDMCases.com under the try section. And we're going to do case number 50. All right, so we're going to run this case. All right, there's going to be 7 parts, as you can see here. So let's just go through it. A 23-year-old female presents at the office, severe headache. She has right temporal pain. So it's sharp, 9 out of 10 on the pain scale. She's had seven episodes over the last month. Severe pain, tearing her right eye, sweating, runny nose. They'll wake her up from her sleep. They can last between 20 minutes and 2 hours. She'll occasionally have nausea and vomiting. Lying down makes it worse. She prefers to walk around. Ibuprofen's ineffective. All right, so you look at her vitals. They look fine. So what do you want to look at? We're talking about headaches, so let's do a neurological exam. And then let's do an eye exam because we're talking about tearing her right eye. Which will this will translate into just the head, ear, and throat exam. So we'll get also the nose. Okay, so we'll submit that. Okay, so neurological exam comes back, it's normal. AGENT exam comes back with miosis of the right eye, rhinorrhea of the nose. Okay, so what initial test should we order? So let's do. You can't abbreviate on the CDM cases on the real test, so you have to write it out. So complete blood count and basic metabolic panel liver function test. Okay. So the CDM cases will allow you, like in the real test as well, they'll have usually extra spaces. So if you thought of something that they didn't, you can put it in, but they'll really grade you on what they're looking for. So I'm just going to put 3 here. And there's no CMP for some weird reason on the COMLEX. Okay, so you can't put complete metabolic panel. To them, that doesn't exist, so you got to separate it out. I don't know why, since everyone uses that, but there you go. All right, so let's go on to the next thing. So CBC is normal. We have low bicarb. That's probably just static. Liver function test looks fine. Okay, what imaging? So let's do an MRI of the brain. Okay. And MRI of the brain comes normal. All right, what initial treatment? So sounds like a cluster headache. We've ruled out organic causes. So let's do 100% oxygen. When I say organic, I mean like there's malignancy in the brain. So we can assume it's a cluster headache. Okay, so let's do 100% oxygen. Okay, so we give 100% oxygen. Treatment's ineffective. So what else can we do? So let's do sumatriptan intramuscularly. Okay, so you have to put the route. If you don't put the route, like by mouth, intravenously, intramuscularly, sublingually, you'll get it wrong. So you got to do that. So let's submit this. All right, IM sumatriptan is administered. Treatment's effective. Patient feels better. Okay, what can you do to prevent future episodes? So verapamil by mouth. That can prevent cluster headaches. Calcium channel blocker. All right, next. Patient started on verapamil. What's the diagnosis? Cluster headaches. All right. Next, it'll grade it. And there you go. I got 100% because I've done it a million times. So, cheers and celebration. So we go, it grades it. So we got the neurological exam. We did the HE&T exam. The initial labs, we did that. MRI, 100% oxygen, sumatriptan, verapamil. The diagnosis of cluster headaches. Okay, and then there's a little case summary. You have this, it tells you do CT MRI to exclude abnormalities of the brain, pituitary gland. So try 100% oxygen, but we needed to do abortive treatment, and then you can use verapamil for long-term treatment. All right. Well, thanks for watching, and we have 2 free cases at CDMCases.com under the try section, and we'll have 100+ cases that you can purchase if you are interested. Thanks for watching. Bye.